Good evening, doctor.
Good evening. Hi.
Yeah, how are you, ma'am?
Fine, good.
Hope everything is okay from your side, right?
Yeah.
Okay. Good evening, doctor. Oh, something is
Good
repeating.
evening. Hi.
It's my voice only. Yeah, how are you, ma'am?
Me and you. I don't know about the others. I don't know about the others.
Yeah, ma'am. 1 minute, I'll be back.
Okay.
Yes, can you start sharing the presentation? Yes.
Yes.
There is no introduction.
No, not that one, madam. Introductory slides will be there. My colleague will share. I have an issue with my laptop. That's why.
Okay. Shall we wait now?
Just couple of minutes,
Yes.
ma'am. We will start soon, very soon, inshallah. Just couple of minutes.
Okay.
We'll set up, inshallah.
Inshallah. Okay. I'm waiting.
A gentle request to all, please mute your mic, except speaker and Mr. Ramanna.
Ramanna, now it's 7:05. We have to start now, please.
Good evening, all. Dear Ramana.
Yes, Sardar bhai,
Hello.
good evening. We can hear you.
Good evening. Good
Yes,
evening.
Yes,
but my
Sardarji.
video is not working. I don't know, something went wrong. Not a problem. We will get started on time.
Let's start.
Yeah,
Mr.
we can
Sadar, let's
start
start.
now.
Bismillah.
Riaz will
Okay.
open slides.
Yeah, I'm here.
Assalamu alaikum.
Alaikum
A
salam.
warm
Good evening.
welcome from
Good evening,
American
doctor.
Society Kuwait Chapter Secretary. I welcome all participant, EC member and advisory committee and our guest to this wonderful evening of technical meet on risk and mental well-being during COVID-19. It is showing your enthusiasm and participation and curiosity that 100 plus people have registered for this and they will be joining us during course of the time. So I welcome you. Let us start with today's agenda. The agenda goes like HSC moment and then welcome address, which I already did it. And after that, presidential address by Mr. Jahid Thakur. Then speaker introduction by Deputy Janet Nazare. Presentation, online quiz and facilitation of a speaker. Online certificate distribution to quiz winner. And followed by vote of thanks by Vice Committee member Jahida. So let us start with our HSC moment for today, which is very relevant for present day, which we are struggling with. As you are aware, this is Zoom virtual platform. Sometimes there will be a delay transition. So bear with us.
Riaz, share audio, please.
There is some audio issue.
The message for HSC moment, though the sound was a little vague from MOH, that it is saying social distancing, wearing masks, which we all are adhering to. So that will help us to prevent this pandemic and help us to safeguard our community. Now I will welcome or invite our president for his address, Mr. Jahid Thakur.
Assalamu alaikum. Good evening to all. Hope I am audible to all. Right, Sardar?
Yes.
Thank you, Riaz. Assalamu alaikum. Good evening. Myself, Jahid Thakur, the president of ASSP Kuwait chapter for the term 2020-2021. Hope you and your family members are doing well. Starting with, may Almighty Allah give us the strength to overcome this COVID-19 pandemic. I would like to welcome our today's speaker, Dr. Al-Anud Al-Atiq, Dr. Seka, Head of Vice Committee, Ms. Janet, Deputy Head of Vice Committee, Zahida Farooq. These are the three backbone of our today's event, and they had worked hard and arranged a wonderful event, risk and mental well-being during COVID-19. As you all are aware, this is the fourth event of this month organized by Kuwait chapter, and within couple of months, this is the 10th one. And inshallah, we will try to do our best to give to the members benefit. Thank you very much. Over to you, Safdar.
Thank you, Mr. Jahid. Now, this is the brief of chapter activity, what we have done in recent past, and those who are new, they will be also getting familiar of our activity. There are a few glimpses of the training on hazard identification and risk assessment and control. The other few trainings are process safety management technical meet, which is always happening on the 3rd of Wednesday. So who are interested to enhance that process safety skill, they can join us. And this is some glimpses of our annual general body meeting, which held on 23rd of July, where 84 members had participated that. This was training on Global OSHA 101 General Worker Safety, equivalent to OSHA 10 hours, which was much awaited course to the benefits of member. In future also, we have a plan. So those who are looking for international credential like this, so watch for our recent announcement. Then we were having a committee orientation meeting for the new term 2020 and 21, where all 45 members of comprising 11 committee has participated and understand objectives and deliverables for this term. This is another process safety management technical meet, second, where 42 members participated on August 19, where speaker were Chandrasekhar and Mr. Mualla Ram. There was another technical meet on significance and preparation of HSE plan by our expert trainer, Mr. Arshad Ayyub, where 60 members benefited on 24th of August. As you are aware, we have done this virtual ceremony for ASSP GCC HSE Excellent Award to promote safety standards to the private company. And it was long awaited, and we were forced to do this virtual ceremony. Alhamdulillah, with your support, we made it as a grand success, and more than 105 more participants has participated in this, and it was live on YouTube as well. So those who are frequently visiting social media can still see on YouTube. This was technical meet on commemoration of International Day for Preservation of Ozone Layer by eminent speaker Mr. Abhay Kashyap on 16th of September, and 45 members participated and got benefited knowledge from this event. This is the recent process safety management technical meeting number 3, where 2 different speakers spoken on this occasion, and 82 members were benefited by participating and understanding the process. We have excellent webinar on environment and sustainable management in process industry, supported by Chola MS Risk Services, and 60 member benefited. It was well organized by Chola MS, by Mr. Speaker V.S. Bhaskar and his supporting team. It was excellent presentation on environment and sustainability. Now I will invite our Deputy Vice Committee,
الحمد لله رب العالمين.
Ms. Janet Nazare.
انت عامل ايه يا ابني؟
Janet Nazare.
Hello.
Yes, madam.
All of you can hear me?
Yeah, keep your microphone
Yes.
closer to you.
Hello. Yeah.
A little louder.
A very good evening to one and all present. Myself, Janet Nazare, Deputy Head, Vice Committee. On behalf of Dr. Shekha Al-Fajam, Head of Vice Committee, I will be sharing today the glimpse of Vice activities. So, respected Chairman, Advisory Committee, ASSP Kuwait Chapter President, Executive Committee, all the attendees, distinguished speaker, and my fellow colleagues. It is my pleasure to welcome you all for today's Risk and Mental Wellbeing during COVID-19, a technical meet organized by Vice Committee of ASSP Kuwait Chapter. I would like to thank you all for sparing a few hours of your valuable time to participate in this technical meet. This is the second program of Vice Committee for the new session of ASSP Kuwait Chapter for the year 2020-2021, which is completely conducted on the digital platform in line with social distancing norms due to COVID-19 pandemic. So here I would like to also share some glimpse of the Vice activities that we have done sometimes back. So we can see that ASSP Kuwait Chapter Vice Committee, we had held a session on professional development on health safety for women in the month of December 2019. And the renowned speakers, Dr. Ibtihal Al-Habib, Dr. Mariam Al-Awadi, Dr. Intisar Al-Hindal, and Dr. Mai Al-Hazar were the speakers for this event. We had a panel discussion on women leadership in professional career, which was chaired by Engineer Modi Al-Azmi, Samira Al-Kandri, Sara Al-Azmi, and Rima Al-Awadi. Last year, in October 2018, we had conducted a session on breast cancer awareness program, which was held, and 25 women participants were who were there attending this session. And very soon, like in the next month also, we are planning to have another session for the breast cancer awareness program, which is October month is considered as the breast cancer awareness month, and during that time we have also planned another program from Vice side. And in 2018 we had also conducted blood donation campaign in collaboration with Shoaib Medical Center. 100+ donors have participated in this. We had a meeting with BCSP representatives at our Hotel Best Western. Then women leadership challenges in oil and gas sector. This was held at Hubara Center at KOC on 21st of February 2018. First aid and CPR awareness program also we have conducted, and whatever programs that we are conducting for ladies, it is in line with ladies' requirement. Usually we are doing a survey with the ladies every time when we have a program, and then with the demand we are keeping the program which is relevant to help the ladies, like for example like first aid and CPR awareness program. This was also held at the Hilton Hotel. Then we had a very good speaker for a topic with health concern for women of menopause. We had a technical meet on nutrition for women at every stage. You can see the pictures. Then firefighting awareness program, which was held with Kuwait fires KFD. They had helped us, and with their support, we had conducted this program for all the ladies. We had this meeting with ASSP USA delegates. You can see the meeting that every 2 years, once in 2 years, we have this program. Also, I would like to encourage here the participants, whoever is the attendees, that please encourage your women colleagues to join the WISE team, because WISE, the main vision of WISE is to promote equity and advancement of women in the safety profession. And we strive to address current and future safety challenges affecting women in the workforce locally. And we offer education and leadership opportunities to help our members develop to their fullest professional potential. And under the leadership of Dr. Shekha, we have created a WISE members WhatsApp group for networking and discussing any issues if needed. So I would like to encourage, and I would like all the attendees to encourage the lady members to join the WISE team. Now I would like to, the most important part of the program, the speaker. Today's topic is, and we'll be sharing this today's topic. And I would like to introduce Dr. Al-Anaud Al-Atiq. She's a senior occupational medicine, Shueva Industrial Medical Center, Ministry of Health, Kuwait. She is occupational senior physician, graduated from Medical College, Kuwait University, 2004, working in occupational health department since 2007. She has done her master's in occupational health from University of Birmingham, UK. She is the PhD. She has done her PhD in industrial medicine and occupational health from University of Alexandria, Faculty of Medicine. And also, I would like everyone to know that today she has become an official member of ASSP Kuwait chapter. So we all welcome Dr. Al-Anaud to present this session. Over to Dr. Al-Anaud.
Hello, everybody. Salam alaikum. Thank you, Janet, so much. I appreciate that. And I would like to thank the American Society of Safety Professional for this lecture. And can we start now?
Yes, doctor, go ahead.
Yeah, but I don't see the presentation.
Yes, he's sharing.
Yeah.
Yes.
Yeah. You will control?
Yes, I will do from here, okay?
We will start from here.
Yes.
Can I have control like yesterday?
Yeah,
can you please try?
Okay. Yeah, shall we start now?
Yes, you can start.
Yeah. Okay. Bismillah ar-Rahman ar-Rahim. So we will start our lecture today. First of all, what is coronavirus? coronavirus 2019, COVID-19, is an infectious disease caused by novel coronavirus, now called severe acute respiratory syndrome, coronavirus 2, SARS-CoV-2. COVID-19 is emerging respiratory infection that first discovered in December 2019 in Wuhan City, China, characterized by rapid transmission and can occur by close contact with an infected person. World Health Organization, WHO, announced a public health emergency of international concern and called for collaborative efforts of all countries. WHO declared COVID-19 a global pandemic. So what is the symptoms of coronavirus? Coughing, fever, shortness of breath, pneumonia, vomiting, diarrhea, and in advanced cases, there may be complications that lead to death, like severe pneumonia and kidney failure. Monitor your health, communicate to your immediate supervisor, department immediately. Can we go to the, yeah, you can monitor your health, communicate with immediate supervisor, department if you notice any of these symptoms, like fever, cough, shortness of a breath or difficulty breathing, chills, repeated shaking with chills, muscles pain, headache, sore throat, new loss of taste or smell, runny nose, pneumonia, and these symptoms may appear between 2 to 14 days after exposure to virus. What is the precaution of COVID-19? Wash your hand, cover a cough or sneeze, do not touch your eyes, nose, or a mouth. Keep your distance, stay home, and get help if you experience any symptoms of COVID-19. COVID-19 pandemic in Kuwait. The first confirmed cases in Kuwait was announced on 24 February 2020. As of 22 September, there are 99,964 confirmed cases of COVID-19, with the 9,930 recoveries and 585 deaths, which is a big number. The safety measure in Kuwait. We noticed there was, yes. Hello.
Carry on, please.
Can you go back to the previous slide? Yeah. Safety measure in Kuwait, there was a lockdown, curfew, partial or total, zonal isolation. There was a daily press conference, a quarantine, and testing PCR for the coronavirus for the newly diagnosed cases and the newly arrived to Kuwait. And of course, you know that during these changes, we experience new things in our life. This is a new things for us. And it causes a stress, discomfort for us. Which causes psychological impact of COVID-19. COVID-19 causes universal psychological impact on population. The fast spreading of the corona disease has been causing universal awareness in change. Can we go to the other slide? Yeah. What is the psychological factor of COVID-19? There is social distance, isolation, loneliness and fear, lifestyle changes, inadequate information, inadequate supplies, job loss and financial hardship, and and finally death of loved one. The mental health problems, stigma, anxiety, panic attack, depression, and suicide. Sign of a stigma: feeling of shame, hopelessness, and isolation. Lack of understanding by family, friends, and others. Fewer opportunity for employment or social interaction. Bullying, physical violence, or harassment. Drive people to hide the illnesses to avoid discrimination. Prevent people from seeking health care immediately. Discourage them from adopting healthy behaviors. The signs of anxiety: persistent worry or feeling overwhelmed by emotion. Excessive worry about a number of concerns such as health problems or finances, and a general sense that something bad going to happen. Restlessness and irritability. Difficulty concentrating, sleep problem, and generally feeling on edge. The signs of panic attack: sweating, trembling, shortness of breath, or feeling of choking. Pounding heart or rapid heart rate, and feeling of dread. Such attacks often happen suddenly without warning. People who experience panic attack often become fearful about when the next episode will occur, which can causes them to change or restrict their normal activities. The signs of depression: lack of interest and pleasure in daily activities, significant weight loss or gain, insomnia or excessive sleeping, lack of energy or inability to concentrate, feeling of worthlessness and excessive guilt, recurrent thoughts of death or suicide. The signs of suicide: talking about dying or harming oneself, recent loss through death, divorce, separation, or even loss of interest in friends, hobbies, and activities previously enjoyed, changes in personality like sadness, withdrawal, irritability, or anxiety, changes in behavior, sleep pattern, and eating habits, erratic behavior harming self or others, low self-esteem, including feeling of worthlessness or guilt or self-hatred, no hope for the future, believing things will never get better or nothing will change. So this is from a newspaper in Kuwait that said that COVID-19 increases the suicide rate in Kuwait, and there's 40 people took their life in the past 4 months, which is in June. And you see most of the suicide occur in the non-Kuwaiti nationality. So who's at risk of developing psychological problem? Those with having previous mental problems, with a chronic disease, elderly, healthcare worker, migrants, and low social class. This is an interesting descriptive qualitative study by Parak Al-Ahmed and his colleague, which is published June 19, 2020 in the British Medical Journal with the title COVID-19 Stressors on Migrant Workers in Kuwait, Cumulative Risk Consideration. I will concentrate it in the main points of this study. Here, there is multiple stressor in different domain can interact each other, resulting in a cumulative risk. We notice here that there is 4 domain, and the highlight domain, the occupational one, cannot be viewed in isolation from the other domain, like individual, environmental, and community. So what did we mean about occupational hazards? The occupational hazards meaning the work hazards like physical, chemical, work shift, long working hour, plus if the preventive measure available at work or not. Environmental, meaning the house condition. Most of the migrant workers living in a small room, living together, share the toilet, plus the air pollution around them, which increase the potential for the COVID-19. The community, 70% of the non-Kuwaiti subpopulation are males and not occupied by their family. The family need a financial support. So this has put a stress on them, especially during the lockdown and the curfew. There was a problem, maybe they are not having their payment or late payment, which has increased the stress on them and increased the option to get COVID-19. Individual, most of the migrant worker in Kuwait, we see it is, they are young, healthy, but those with the comorbidity diseases such as diabetes, hypertension, they are more vulnerable to COVID-19 exposure. In addition, smoking habit, the type of the diet increase the risk of COVID-19. Here a table from 6 step concentrated in a cumulative risk assessment framework to COVID-19 stressor among migrant workers. So they put simple question and answer so we can reach to the intervention and the solution. The first step, the importance of the problem. Why does COVID-19 outbreak among migrant worker matter and who should care? So according to this study, 80% of the total cases have been non-Kuwaiti nationality, and the outbreak uncontrolled outbreak of the COVID-19 happened in clusters of migrant workers, which can result in catastrophe outcome, including the loss of life, loss of economy, affecting the healthcare system. The second step, population of interest. Which migrant workers are disproportionately affected by COVID-19? So most of them were male and men, Asian, and those who work in retail, food, transportation, security, construction industry that are continuously interacting with the community, so they are more vulnerable to get infection. The third step, the potential stressor hazards. What are the identifiable stressors associated with the COVID-19 infection or risk infection, and when in what domain that we discussed in the previous slide? Exposure pattern. How does these stressors from step 3 contributed to the overall health of the migrant worker? So we see the migrant worker usually have the dangerous job, having a language barrier, culture barrier, so they may be affect the message during the lockdown, the curfew of COVID-19 that reach to them. And also they may have difficult communicating with the medical professional. Moreover, we noticed that numerous report person-to-person transmission of the COVID-19 occur among the migrant worker because they are sharing one house with the poor air ventilation, sharing a toilet, so there is impossible for self-isolation. In addition, the individual, mostly the migrant worker, have low educational level and low income, which is more likely to expose to factor contributed to poor health compared with those that having more socio-economic resources. The 5-step cumulative risk assessment consideration. What do these stressors and how do these stressors interact and overlap across the 4 domains for migrant worker? And the 6th-step, potential intervention. So what risk management approach, exposure reduction strategy, and the occupational safety health prevention measure can be applied to migrant workers affected by COVID-19? Can we go to the next slide? So potential intervention, we will discuss it in more detail. stop the spread by community and individual. This is what happened in Kuwait during the lockdown and the zonal isolation and curfew. The healthcare access, we noticed that most of the migrant workers have the free access to the hospital for testing and treatment of COVID-19. Plus, there is a drive-through and walk-in testing. There is mobile clinic and field. Temporary housing like workplace, environmental, and community, because of the migrant worker are not able for self-isolation, we see that the government provided housing and temporary housing for them. Information access in the workplace and the community. During COVID-19, we noticed in the television, in the media, social media, there is information, message for different message of 19, it should and to give them their payment. And community support by workplace environmental and the meals, medication for all the migrant care. And then last step, continue in all the domains. This migrant worker of public health face language and culture barrier, take job with more hassles, less pay and longer hours. So COVID-19 has played multiple extraordinary stressors on the migrant worker in Kuwait. The management of the mental health during COVID-19. Take care of yourself. Take care of your staff. Take care of your patient. Take care of yourself. Feel free to feel your feeling. This is normal during this COVID-19 pandemic. Eat healthy, drink more water, take vitamin C. Stay away from toxin like smoking, alcohol. Reduce stress by doing exercise, yoga, meditation, and praying. Safer practice at work. Report to work if you are feeling unwell. Monitor yourself for symptoms of anxiety, depression, and etc. Take breaks from news and social media. Connect with others, talk with people you trust about your concern and how you are feeling. Take care of your staff. Adjust staffing procedures and schedule where possible. Offer access to psychosocial support. Monitor and review staff member well-being. Create an environment of open communication. Take care of your patient. Establish a system to identify and provide care of mental health conditions. Facilitated additional training for frontline staff. Establish referral pathways or patients with a mental health condition. Provide a clear, understandable communication to patients. So this is a brochure from different organizations, WHO, NIH, different brochure you can get from the internet, how to cope with the stress during COVID-19 outbreak, and you can print it and distribute it to your employee. So the last, we finished like this. So thank you very much. Do you have any question?
Thank you, Dr. Anud, for your wonderful presentation. Am I audible to
Thank
the
you so
audience?
much.
Yeah.
Thank you so much.
Participants, please hold your question. Meanwhile, I am just addressing few things. We will be having a quiz, and the quiz will be shared by a link to you in a chat box. You will be having a question. You have to answer within 3 to 5 minutes, and whoever answer first, 5 will be recognized right now. Those who cannot be able to respond within 5 minutes will be getting a certificate of participation for this technical meeting. Meanwhile, you can think of your question which was related to this presentation, where Doctor has shared her technical meet and some issue related with the COVID we are having for well-being. You can post your question if you believe it on the chat box, or you can speak by opening your microphone. We have posted the link to the chat box. All of you can be able to see. Okay, now there is question related with this presentation. Those who have a question, please post your question or unmute yourself to the question to Dr. Anud. Hello, Ramana.
Yes, sir,
Hello.
Daji.
Yes, we have posted the link to
Yes, sir. Safdarji, I'm with you.
the quiz.
Yes, yes,
Okay.
I am receiving the answers also.
Yes. Any question related to the presentation?
Yeah, our advisory committee member Ashok Garlapati asked
Okay,
a
I will
question.
read. Yes, I will
Yes.
read. Okay. Madam Anud. Hello, Dr. Anud.
Yes, hello.
Yeah, there is a question,
hello.
madam, by one of the participants. Many expat workers are missing their family due to due to flight shutdown.
Yeah.
How can they manage their stress? I will repeat the question again. Many expat workers are missing their family due to air flight shutdown.
Yeah.
How can they manage their stress?
As we discussed before for the management, we said take care of yourself. There is many steps how to cope with the stress. We discussed it before that you eat healthy, making meditation, talking about your feeling with the others. If you're feeling unwell, you have to express yourself. And now with the technology, there is a lot of a program that you can connect with them or call them a video call. So it is easy, not like before. But we put this coping strategy.
Thank you, doctor. It was saying that there are many mediums are available to cope up with this stress.
Yeah.
There is another question. What is update about corona vaccine arrival? Any update about corona vaccine arrival?
Yeah, I noticed during the newspaper and during my writing, there is a lot of experience under experimental, the vaccine for different country. And I think Kuwait is willing to buy these vaccination, but until now, no success. Like in the UK, they said it is, they get vaccination and after experimental, they said there is side effect. So we don't know, we are waiting.
Okay, thank you, doctor. For those who have a COVID-related question, we are having a group that COVID Management Committee, we
Yeah.
are usually posting some of the alerts and literature related to the development of the corona vaccine, which country is ahead and what is the statistics. So those members who have not visited our committee portal or our SSP WhatsApp number, they can register the number so they can get that alert on a weekly basis. Yes, any other question from participant? Yeah, there is a question from participant. Suppose we have a first aid certificate.
Okay.
Doctor, yes, madam. We would see a fainted person anywhere. Is it not safe to intervene, touch, or what can you suggest?
I think you can do the ABC first aid, but you can touch him. But for the breathing, I don't know. You cannot do it mouth to mouth.
Great.
And during that, you have to call the ambulance.
Yes, so the elaboration is that you can still perform first aid without breathing to the person, right?
Yeah, but it depends. You have to examine him. Do ABC. You see he's conscious, not conscious. He's communicating with you or not. So you can understand his situation.
Yeah, okay, okay. I think there are some questions were not related with the presentation, but there are a few questions that how can we help the worker who are not receiving their salaries?
I said, I don't know if there is agreement between the private sector and the government sector. If there is any agreement between them so they can receive their payment. I know that it is very stressful. I know that it's very stressful for them and causes so stress and psychological impact. But each company should giving their salary or they giving half salary be agreement in each company. There should be a law, private law.
Yes, great, madam. Thank you very much on this. There was another question.
Yeah.
It's saying coughing is common among smoker and chain smoker. It is find hard to give up smoking. What do you advise to a smoker to prevent coughing?
I cannot advise them to prevent coughing because the smoking causes a problem in the respiratory symptoms system and the lung. So I advise them to stop or reduce. And we have in our clinic, Shuaiba Industrial Center, there is teaching class and some we give advice how to quit smoking. We can help him if he come to us.
Yes, great. That is a rehabilitation center, which is guiding people how to quit smoking.
Yeah, we have. So he can come to us and we can give him some advice and the steps how to quit smoking.
Thank you, doctor, for your nice explanation of this question raised by the audience. Ramana here.
Thank you.
Ramana?
Yes, Majaji. I'm ready.
Are you ready with this? Now, I will ask our president or Mr. Majhar.
Yes,
are
please.
you around? Mr. President Jahid Thakur.
Let Ramanna announce. Majhar is having internet issue, connection issue. Let the.
Okay.
Yes,
okay,
Ramanna.
Okay, Ramana, go ahead, please.
Yeah. Thank you very much, Madam Dr. Anud. It was wonderful presentation from your side.
Ramana,
Thank you so much.
Ramana, at the end of this facilitation, I will take 1-2 more questions if the time permits. Okay, I can see some questions. Okay, that's fine. Go ahead.
Time is there. Thank you. Thank you, ma'am. Just As a token of appreciation, we are giving a felicitation through online. Okay, please accept our certificate as well. This is the online. This is the one how we are doing online. Oh, sorry. Oh, did you get the sound? No.
Yes, Ramanna. Yes, Ramanna.
There is some issue again. There is. Okay. Thank you once again, ma'am. We appreciate your
Ramana, there is something mistake in
Thank
this.
you.
Not
My
a problem.
pleasure.
We'll clear it. Okay, Ramana.
Okay, okay.
Yeah, here it is okay. Galas, class. Okay, here is
Yeah.
okay.
Okay.
It is a pleasure for us that Dr. Anood is with us as a technical speaker, and this was an honor to you, madam, as a token of appreciation from KC Kuwait chapter.
Yeah, me
Now,
too.
yeah, this is
My
time
pleasure
to.
also.
Yes, madam. Yes, madam. Now it's time to announce the quiz winner, Ramana. Can we have the numbers? Please go ahead with
Yes.
us.
Yeah. Thank you all for participating in the quiz. We have received around 35 answers, and within the stipulated time, we have chosen 5 quiz winners, and here you go. Congratulations, Mr. Muhammad Ibrahim.
Ramana, we need to correct that title. This is well-being COVID. Okay, you need to take care of this. Okay. But anyway, you have announced it. Okay, not a problem. I understand there is time short, and somehow we have to manage it. Okay.
Okay. Shall I announce? Otherwise, shall I announce only the name?
Go ahead with
Ramana,
announcing that.
go ahead.
Go ahead with this. We will correct and send it.
Okay.
Okay.
Screenshot will be there, no? Okay. Congratulations to Mr. Iqbal, Sheikh Iqbal Ahmad, Sheikh Ansari, for answering all the quiz questions for today's session. Congratulations, Mr. M. Muhammad Iqbal, for answering all the quiz questions. Congratulations to Mr. Muhammad Kasif Raja for answering the quiz questions. Congratulations to Mr. Jakula Ramchandra Murthy, who has answered 4 out of 5. And these are the people in answered in stipulated time who has answered almost 5 out of 5. There are so many, but little bit less they have answered. Thank you for participating, and we'll continue with our closing remarks.
Oh, okay. Thank you, Ramana. Before I will invite Madam Jahida Farooq, Madam Doctor, Madam Doctor Anood, are you able to hear me?
Yes.
There was a question by a gentleman.
Yeah.
How can we recognize tension headache?
Tension headache?
From headache due to COVID.
Headache from during to COVID?
Yeah, I will repeat the question again. How can we recognize tension headache from the headache due to COVID? As many nowadays complain of headache only when tested positive of COVID-19.
He was having headache.
Yeah.
And then after he got to the doctor, he have positive, yeah?
Yeah.
COVID-19.
Yeah.
But he didn't have any other symptoms like fever, cough.
Yeah, no.
Yeah, I think this is one symptoms of COVID-19, of the COVID-19. So he should go to the physician or to the clinic and he can explain to the doctor if he have a close contact with the positive cases. We have to ask this question. Did he have a close contact with the positive COVID-19?
Yes. Okay. Thank you, Madam Doctor, on this.
Yeah,
And
so for headache,
yeah.
there is a differential diagnosis. I know if you have headache, there is differential diagnosis for each doctor, but it depends on the history. So we have to dig in the history to reach our diagnosis.
Right. So additional follow-up and checks are required along with the other symptoms you have just mentioned in your presentation.
Yes.
Thank you, Doctor, very much on this excellent answer on this. Now, this is time to I welcome you as a new member today. I come to know that you are a new member to ASSP Kuwait chapter.
Thank you so much. Thank you.
And you are adding another feather to the crown of the WISE team.
Thank you.
Alhamdulillah, together
pleasure.
with the community, we all are growing. Thank you very much, madam.
Thank you. Thank you so much.
Pass this message to the fraternity of WISE who are working along with the different discipline, and spread the message of ASSP Kuwait chapter, what we are doing and how we are doing it. Now, this is time to invite Madam Jahida Farooq for the closing remark. Now, after her closing remark, this networking platform will be on for another 10-15 minutes for a networking purpose. Those who wish to be part of this, they can continue. But now it's time to call for closing remark by Madam Jahida Farooq.
All praises belongs to Almighty Allah, who saved us, who is protecting us from the current pandemic situation, which we all are going through this. Assalamu alaikum to our Honorable President, Honorable Speaker, my Head of Committee, Dr. Sheikha, and our esteemed guest. A warm and graceful evening to all of you from Jahida Farooq, Member of Vice Committee. It's my pleasure to present the vote of thanks for this program. On behalf of Vice Committee of ASSP Kuwait Chapter, I would like to convey my sincere thanks to our speaker, Dr. Al-Anud, for providing us informative session on the current situation to understand the risk and measures to control the mental stress. I also extend my sincere thanks to our President, the ASSP Kuwait Chapter EC members, our Head of Vice Committee, Dr. Sheikha Al-Fajam, Vice Committee members, Ms. Janet and Ms. Ahlam, and the whole team who worked behind and provide their support for making this event successful. We thank you once again for being with us this evening. It's been really a great pleasure. Stay safe, stay healthy, take lots of care, and have a nice weekend to all of you. Thank you once again.
Thank you, Madam Jahida Farooq, for wonderful closing remark. We are well ahead of time. Still, we have time to do little networking. Any comments and remark from our advisory members? If Mr. Ashok, Mr. Ujwal, Sir, and others are around.
Thank you, Mr. Safdar. Assalamu alaikum. And it's a very good initiative from the chapter to have this particular program. In fact, I'm sure everybody is aware that many expat workers are undergoing the same stress levels because of last 6 to 7 months that are not able to contact them or communicate with their families. Thank you for arranging this particular session and giving the advice by Dr. Who is expert in her field. In addition, the chapter has initiated this COVID-19 management committee. That's another good initiative the chapter has taken. I'd like to congratulate them, as well as because they are sharing the weekly updates, which really gives a lot of good information particularly related to the vaccine development, where we are heading. And so that's very interesting to know, Safdar. It's a good idea. Thank you very much.
Thank you, sir, for a word of encouragement and insightful message. Anyone have another message by our Vice President Major Sheikh or Mr. Badr, or if Noor Al-Sadi is around?
Yeah,
Before
first
that,
of all,
can we have a group picture before we
yeah, I request
participants go
everyone to
through?
Yes,
open your
everyone
camera.
open your camera, please, for a group picture. Please open your camera if possible.
Madam Dr. Anud, please open
Yeah,
it.
I didn't open. Yeah,
Yeah,
sorry.
yeah, it's okay now.
Yeah.
Thank you. Our secretary turned off his camera.
No, my video is not working, so I'm sorry about that.
Oh, okay. Good. Thank you.
Thank you very much. Now the floor is open for networking. Those who want to have a networking, start is one by one to the question, and we can do a little networking. Officially, the meeting is over right now, and if one minute, if Madam Dr. Sikha Aflam is there. Madam Sikha Afazam, are you audible to us? We are missing your sweet voice, madam, for this wonderful evening. I know there is a connectivity issue and we struggle hard to maintain the connectivity somehow. During presentation also, sometimes it was freezing, so bear with us. This is a part of virtual ceremony. This training usually do happens because the big connectivity. No
yes,
problem.
I'm here.
Yes, madam. Any message for us as an audience? We would like to hear your sweet voice.
Yeah, I'm really sorry because I'm, to be honest, I'm in Failaka Island, so the connection was not really good. What was on offer? Okay.
Mashallah, great. We are hearing from Failaka Island.
Yes, yeah. ASSP reached to Failaka Island.
Yes, great. You are the pioneer to pass the message across the sea.
Yeah. So thank you so much for attending our event. I really appreciate your support and your presence, and spending time for us is really appreciated by our side. And I want to also thank Dr. Aloud for her presentation and for her efforts. I'm so happy that she's now becoming an official member, and I'm sure that she will be of value to our committee. And I would like also to thank Zahida and Janet Ahlam for their support. Without them, I wouldn't be able to do anything, to be honest. Thank you so much.
That's great, Madam Dr. Sikha Fazam, for your nice, encouraging word for your team as a leader. Now, if our President, Mr. Majhar Sheikh, is there.
Thank you, Mr. Safdar.
Vice President Majhar Sheikh, for your comments and suggestion. Yeah.
Before we leave, I would like to thank Dr. Alanoud Alatik, ma'am, for sparing her valuable time and giving very excellent and very much required information to cope up with current situation, which is like no other we have heard in our lifetime. Ma'am, this is really wonderful, and this shows your commitment to serve the society in whatever manner or whatever whenever required. Thank you so much. Thanks once again. And our special thanks to Vice Committee, Dr. Shekha, Ms. Janet, Ms. Jahida and team. You are always striving towards improvement of the woman in health, safety and environment. Thank you so much.
Welcome.
Mr. Safdar, back to you.
Thank you, Vice President, Mr. Majhar Now I can see Mr. Sunil Sadanan, past president, is around us. Can we able to hear a few words from him? Mr. Sunil Sadanan? Hello? Mr. Sunil?
Yeah. Just now I gave no unmute option.
Yeah.
Let him see. Sunilji, you can unmute yourself now. Okay, sir.
Meanwhile,
Yeah.
Okay, now connection done?
No. You can go carry on.
I can see the vibrant energy which Dr. Anood has generated through this technical meet, and I can see the glow on her face that she has relaxed us with that much thought on COVID, the stress we are going through, and the way out, how we can able to manage when we are dealing with this COVID situation in our workplace, in our personal life, in the family, friends, and far and near. So it's a great effort from you to sparing a time with us today evening. Thank you very much, and we look forward for your support, and good luck to you, madam. Any other audience who wish to do networking, the floor is open. Ramana, now onward, you can please take a lead on this. Thank you all for spending your time.
Okay.
Ramana?
Thank you, Sardarji.
Over to you, dear. Thank you.
Yeah.
Sardarji, I have a question to you.
Yes, sir.
Of course, in our chapter, we have almost 600 plus members. I'm not sure whether we have done a welfare check of our members. So I recommend you to send a group email, welfare check due to COVID-19 of our members. So because we are all supporting COVID-19 monitoring activities in our facilities, I don't know whether anybody is really got affected and how is their condition. So as a responsible or as some supporting chapter activity to its members, I don't know whether you're aware whether anybody has succumbed to the COVID-19 or something like that. So maybe you can make some Google form link just to share, whether they are affected or whether they are recovered or what is their condition, something like that. Just an
Okay,
idea.
sir. Okay, sir. Well taken your advice on this. We will float this welfare check for COVID-19. But verbally, we were in touch with this, and our past president, Mr. Sunil, along with the vice president, Mr. Majhar, were looking for those members who are partially or far affected by this. So we are knowing two members were affected by this, and they have recovered it well. And few members who were suffered with this loss of job and other activities were there. So we tried to whatever advice we can do or do a networking to support them during this difficult time. But where your advice was well taken, and we'll float with the Google shared survey as well. Thank you very much, sir.
It's a good idea when you develop the Google form, you can also get some best experience from them who have recovered, so that
yes, yeah.
So that these are the things one can do it to recover fast, something like that,
Yes, sir.
Yes. Thank you, sir, for your suggestion. In fact, we have floated one form and received quite responses. And just now he has advised, he has informed, like some people have responded like that. We will add one more point to know their current status, who have affected, and we'll refloat the announcement, same thing, to get feedback of. Okay, yeah, there is a feedback form which is posted just now. We request everyone to send your comments so that you will receive your certificates. Okay, not immediately. There is a flaw in this. We will receive the feedback, and maybe within half an hour we are going to receive the certificates. There is a trigger mistake is going on, so I was trying to do that one, but unfortunately it couldn't happen. But once we receive the feedback, it is easy for us to send the certificates automatically. We are working on it. Okay, so the data is required. So once you submit the feedback form only, we will receive the exact data, and by using that data, we will be able to send the certificate automatically. Please provide your feedback through the link. If anyone is having any problem related to these links, feedback or quiz, please inform us so that we'll try to correct those errors. Thank you, ma'am, Dr. Shika. We can see the background. We were there in 2013. All ASSC, almost 100 members were there with the headquarters team, ASSP headquarters team. Yeah. Yes, Jayaji, I'm just trying to ask our training committee head, Mr. Ali Arshad, to talk something about it. I'm trying to unmute him. Mr. Ali Arshad, are you there?
Yeah.
Okay. How are you feeling today?
Huh? After this presentation, much energetic, which is very unusual at this hour for me. Yeah. So it was a wonderful presentation indeed, and the Vice Committee keeping its record high enough, again came up with a wonderful session. One point I would like to request to Dr. Shikha and her team, Jahida and Janet, one lecture, because most of us are feeling that mothers are too much worried these days because of their children being forced for online education, and children are not really enjoying that, and mothers are getting much more what to say, anxious. So I think the doctor and as a social activist and as mothers, they can guide us and mothers how to deal with this situation, online education, children's distraction. This topic will be quite useful for the families, I believe. Thank you so much.
Thank you, Ali Arshad. Yeah. Anyone would like to talk? Mr. Sumesh Pillai, would you like to talk now? Okay. Mr. Ramu, are you there around?
Hi, good evening, Mr. Ramana.
Yeah.
Thank you
Hi,
so.
Mr. Maheji. How are you?
Thank you. for arranging good, and all the who speak, the doctors, and given the good answer. And thank you for arranging this program COVID-19. We are so thankful for you all for taking care of all the in Kuwait who are staying there and giving the good advice. Thank you for the doctor who spoke to, I don't know the name, but and I just want to say special thanks to Dr. Seka and Vice Committee Jaida and also Janet. Thank you so much for the good advice. We learned something, and I'm really thankful for you all for arranging this program. Special thanks to all. I have a really blessed time. I enjoyed the convention, whatever the doctor give good advice, and I was so happy. It touched my heart. God bless you all.
Thank you, Mr. Maheshji.
Thank you.
Thank you, Ramanna. Thank you, Dr. Seka. Thank you, Janet. Thank you, Zahida. Really, it is a wonderful event, and the feedback what we are receiving from all the members is very good. And inshallah, this is the showing the commitment. Out of our 12 or 13 committee heads, almost 6 or 7 committee heads are present in all the events. We can say a name like Abul Ifam, Mustaq Mirza, Ali Arsad, Muhammad Yusuf. These are the people who are really the helping hands for ASSP Kuwait chapters, and this is showing the team. Really, Dr. Seka and Janet and Zahida, you did a wonderful event, and inshallah, the next event for blood donation also will be a great success. Once again, thank you all.
Thank you. So
Hello.
sorry, Jayaji. Yes,
Yeah.
please.
Yeah, we will have our next session in October, and that will be breast cancer awareness session. It is planned on the end of the October. So those members, spouses can attend also. And also, I would like to thank Dr. Shekha that her level of commitment is so high that although she is spending her time with the family in Pailaka, she has made it a point that she attends the session. And from morning onwards, she was just struggling that I don't want to miss the session. I want to go there, reach on time, and attend the session. So her level of commitment is very high. That's why because of her support and her cooperation, we are so encouraged to do all these activities. Thank you so much, Doctor. Your leadership, it's really our pleasure to work under your leadership. Thank you so much, Doctor. So nice, really.
Yeah, very few Kuwaitis that too, like Dr. Madam Shika. She is there with us since 4 years. Okay, she is continuing her volunteer leadership. Okay, it shows her commitment. Okay.
Yes,
So
she has a very high level of commitment. She's so much encouraging. We feel
Thank you,
we
ma'am.
don't feel
Thank
like
you
a colleague, but we feel like our sister only. She's like it's such a wonderful to work under her leadership.
Thank you, ma'am.
Thank you, doctor.
Okay. So,
Thank you so much,
Good
Doctor.
evening. Good evening. Wonderful event done by Vice Committee. Great event. We enjoyed a lot the event, and I hope the other event as Vice announced. We'll see more family members to enjoy that event also. We'll get inshallah, we'll get a good knowledge in that also. Thank you very much, each and every head committee members. People worked hard to bring this program on this platform. Special thanks to Vice Committee, all Vice Committee members. Thank you very much.
thank you, Mr. Ramu. Nice to hear from you. Okay. Shall we close the meeting? Or Aliya Saji, would you like to talk something? Sir, you have already given your feedback. I'm just waiting for Mr. Abul Islam if he's around. Yeah, hello. Yeah, Mr. Jakula Ramchandra Murthy.
Yeah, actually, it is a very, very good presentation, very good information. It's and it is, I think, it's very, very good to mention. What are the mental symptoms, condition, caution, everything is clearly. If you can follow and hope everyone will be better than they normally behave.
Okay, thank you, Mr. Jakula Ramchandra Murthy. Though your voice was breaking. Yeah, your voice is not clear, Mr. Ramchandra Murthy.
Okay.
Thank you. Okay. So this is the time to close the meeting, I think. If anyone is there, we were early. Still 2 more minutes.
Hello, everyone. I would like to convey thanks to everyone, especially Ramana and President, and especially Dr. Anuth, our Dr. Shekha, and Janet. Really, it's a great pleasure to me to work under Dr. Shekha. And Dr. Anuth, she become a member of Vice Committee. It gives her more boost to do the more programs with Dr. Anuth, inshallah, in future. And I wish you all stay safe and healthy. Thank you so much once again. Thank you.
Okay. Yeah, because it's live. No, live is going on in YouTube. So try to open your camera so that it will be recorded. Otherwise, we will miss you. At least Wise Committee people should be.
Thank you, Ramana, and thank you, Dr. Shekha.
There in always.
Thank you, Dr. Anuj, and especially to my friend Janet. It's a great pleasure to us, and it's Dr. Shekha's encouragement. It is boosting us to do more, to do work hard, inshallah. In future also, we hope that we will do the blood donation campaign is there, and Wise activity is there. Inshallah, we will do our best, inshallah. Thanks to everyone, especially our president, Mr. Jahid Thakur, and Mr. Mazhar, and everyone else, and Mr. Shabdar Ari Khan. Yeah, we can't forget Mr. Shabdar.
Thank you. Okay. Is there anyone?
We have been also like watching like ASSP Wise Committee in US. Dr. Shekha is always updating us that what kind of activity they are doing, how networking they have. So we are always getting an update from them also. So our vision, mission, and our aim is in line with ASSP USA. So the WhatsApp group what we have now created, it is helping us for the networking among the ladies. This is the first time that we have decided to do so. We have around 22 plus ladies in the WhatsApp group, and it becomes easier to coordinate with the ladies and to make them to understand and to get the feedback from them. It becomes much easier now. So thanks to everyone for giving us the support.
I'll provide you the list of participants today. See if you missed anyone. Okay, you can coordinate with them.
Yeah.
Okay. So we'll close the meeting. Thank you for participating, and see you in the next event. Thank you. Bye-bye. Good night to all.
Bye-bye.
Thank you, ASSP, for conducting.
Bye.